What can I do to keep my eyes healthy?
I think there's probably three things that everyone can focus on when it comes to maintaining eye health. The first is regular eye exams. Especially as we age, there are many eye conditions that can creep up on you without any symptoms. Sometimes you feel fine, you don't notice anything in your vision, but certain eye conditions, especially like glaucoma, like macular degeneration, can start to show up in your eyes before you notice any changes in your vision. And so if you have regular eye exams, then your eye care professional can diagnose these, perhaps suggest some treatment or some prevention strategies that can slow down these conditions and hopefully make it so that they don't ever impact your vision down the road. The second thing is keeping track of your general health, working with your family physician or your other primary care physician to make sure that you're managing all your other health risk factors, things like diabetes, cholesterol, high blood pressure. If left unchecked, these can also have pretty significant impacts on our eyes and on our vision. And so it's really important, especially as we age, to keep all of these risk factors under control with the help of your general physician. And then the last thing you can do is common sense things to take care of your eyes. Wear sunglasses when you go outside, eat a good varied diet, lots of vegetables, orange vegetables, leafy green vegetables, exercise whenever you can. Smoking is another thing that can damage our eyes. So if you do smoke, try to cut down, try to quit if possible. If you don't smoke, don't start. But those kinds of common sense things can also have a pretty significant impact on our health as well.
How long can I keep my eyes healthy?
There's no real reason why eyes should degenerate with time in the absence of any other eye conditions. With the right prevention, with the right screening, hopefully forever.
Are there any foods or supplements that can improve my eyesight?
Eating a varied diet is the best way to protect your eyes in terms of what you're putting into your body. So a varied diet includes a variety of vegetables, orange vegetables, red vegetables, leafy green vegetables. Usually a general sort of varied North American diet contains enough of the right mix of vitamins to protect our eyes. But when in doubt, there are other supplements available, like omega-3 supplements. They may have some benefit for certain conditions like dry eyes, which do affect a lot of people as we age. There are other vitamins, including lutein, which are very popular on the market that a lot of people have heard of. These are more specifically meant for people with certain eye conditions, such as macular degeneration. Large studies haven't really shown a huge benefit to taking these prophylactically or in advance of developing these conditions, but once you've been diagnosed with a condition like macular degeneration, then certain vitamins, including lutein, can be helpful to slow the progression of that.
How does sunlight affect my vision?
UV light can have damaging effects on our eyes. Specifically for conditions like cataracts and other growths on our eyes like pterygia, which are a growth of the white part of the eye or the conjunctiva. Skin cancers around the eye are another condition that we worry about with age, and UV exposure can affect all of these.
How should I protect my eyes from UV light?
Wearing sunglasses to protect against UV light can be helpful.
What are floaters? Should I be concerned about them?
Floaters are small particles or deposits that form inside the jelly of the eye, and they actually do float around, which is why they float through your vision. As they float in front of your eye, they cast a bit of a shadow, and you see them in your vision, and then they sort of float out of the way and you don't notice them as much. Floaters are a very normal part of aging. Children have floaters, adults have floaters, older adults have more floaters. We all have floaters. Floaters increase in volume and in severity as we age. Because they are a normal part of aging, they're generally not a worrisome condition. Signs to worry about would be a sudden increase in the number of floaters, especially a dramatic increase, or if those floaters are accompanied by other symptoms such as flashing lights, or a change in the vision, or a shadow in the periphery of your vision. Those can be a sign that the floaters are something more than just normal floaters, but otherwise it is quite common and quite normal to have floaters.
How often should I get my eyes checked?
Having your eyes checked every year is the best way to prevent eye conditions by early diagnosis and treatment where necessary.
What should I do if my vision suddenly changes?
Any sudden change in vision demands sudden attention. So if you have a sudden change in vision, best is to speak to your family physician if you feel that's appropriate. If you have an optometrist, seeing them right away. If you have nobody, then going into your nearest emergency room. Most emergency rooms will have an ophthalmologist on call, and if you have a sudden change in vision, you have somebody right there who can help diagnose and provide treatment where appropriate.
What causes dry eyes?
There are many different causes of dry eyes. Dry eyes are more common in female gender. As we age, other medications for other systemic issues can often have dry eyes. Anyone who's undergone any kind of eye surgery, whether it's laser eye surgery, cataract surgery, or other eye surgeries, those are all risk factors for dry eyes. And screen time is another big risk factor that we're all experiencing nowadays. When we stare at screens, we don't blink as often. And blinking is necessary to respread the tear film over the surface of our eye so that that tear film can protect our eye. If we stop blinking, the eye stays open, those tears evaporate, and there's nothing left to protect our eyes, and that can cause slow damage over time to the surface of our eyes. Generally, this can be restored through dry eye treatments, but it is important to stay on top of it. And if you feel that screen time is affecting your eyes, then the best advice is to take breaks while you're on the screen.
How can you tell the difference between dry eye and other causes of watery eyes?
Watery eyes are a very common problem across all ages. Eyes produce moisture in the form of tears, and those tears drain away through a little hole in your eyelid and then into your nose and into your throat. So if we think of this system, if tears are running down your face, it's either because your eye is producing too many tears and overwhelming the drainage system, or because your drainage system is not working and it's not able to siphon away the tears the way that it should. Why would your eye be producing too many tears and too much moisture? Usually it's because something is irritating your eye. It's the body's natural response to dust, foreign particles, allergies, but even dryness in the eyes can be a trigger for watering. Dryness irritates our eyes. Your body thinks, hey, something's irritating my eye, and then it floods your eye with water to try to wash it away. And so that cycle is often actually caused by dry eye at the root of it. If you think about drainage problems, usually that sort of tearing is more common when it's on one side relative to the other. There can be blockages in those tear drains that can cause infections and watery eyes, sometimes some swelling or some pain close to the area by the nose. Those can be a sign of a tear drainage problem, but by and large, the most common cause of watery, teary eyes is too much tear production, usually from some kind of irritant like dry eyes.
How can I treat my dry eyes?
There are many treatments available for dry eyes. Using moisturizing artificial tears or natural tear type of products can help to replace the moisture that your eye is not producing on its own. Warm compresses to massage the little tear glands around the eyes can be very helpful. Some people have blocked tear glands with some debris around their eyelids, and so using eyelid washes, either in the form of wipes or solutions, or even a little bit of baby shampoo to wash away some of that debris gently can be a helpful treatment for dry eye. Omega-3 supplements have also been shown in some studies to be helpful for dry eye, so that's something worth considering if you have dry eyes. If none of the simple treatments are working, there are medicated products as well that can either improve the quality of your tear production or the quantity of your tear production. And so if the simple treatments are not working for you, best to talk to your eye doctor about what else might be available.